Guys, let's begin our class for today. Ay, sulit. Okay, sige. Good morning, everyone. Welcome to your class this morning. This is still Assistive Technologies Laboratory with me, your teacher, no? Please prepare your writing materials. Again, let's continue our lesson. Last time, we are still in splinting. I think we finished off with this slide here, the SAM splints. Ito po yung moldable stiff foam. All right. Moldable po siya so that it can accommodate the contour or the shape of our body. Tama ba? Oh, okay. Brown out sa ilan ni Precious. Okay. Hopefully, she can just visit our recorded lesson for today. Sige ah. It's okay. All right. So we're done with the SAM splints. If I were to choose my splint of choice, ito talaga yung pipiliin ko because again, it is moldable. Yet, at a certain temperature, it becomes stiff. So if I really want proper immobilization, ito talaga yung pipiliin ko because it can contour to the shape of our body. Pwede mo siya i-mold or i-shape according sa aton nga body part. So, namiyan ko sa SAM splint. Kaso lang, may kamahalan siya. Medyo a little bit expensive. Okay, next we have here another. Okay, this is the ball. Okay, again, this is the ball anti-spasticity splint. Nasa pangalan na, I think it goes spasticity of what? Of our hand and because if you noted last time, I told you if the patient is CVA, stroke po, the hand has the tendency, the natural tendency to go towards claw hand formation or absence of the intrinsics. So this is non-functional. So mag-a-apply ka ng ball anti-spasticity splint to promote the intrinsic plus position, which is being done or being achieved by our ball anti-spasticity splint. Because the spastic position again of our wrist and fingers or hand is intrinsic minus or the claw hand formation. So we don't want this. We want to eliminate this one. We want to promote the intrinsic plus position. So that's why we use the ball anti-spasticity splint. Ito it positions the fingers and hands, okay, on a reflex inhibiting position. Reflex inhibition position. Ito kasi yung reflex. We want to inhibit this one. We want to promote intrinsic plus. Pag nagpro-promote ka ng intrinsic plus, you reduce the tone of your spasticity. You reduce the spasticity. Okay? So we have ball anti-spasticity splint. You can also recommend this not just in stroke but in any upper motor neuron lesion. Pwede ba siya sa multiple sclerosis? Yes, because anti-spasticity. Pwede ba siya sa spinal cord with affectation of the finger and hand? Oh yes, pwede talaga po. What else? Pwede ba siya sa yung combined upper and lower, yung ALS? Oh yes, pwede siya sa ALS. Any disorders with upper motor neuron lesion, you apply our ball anti-spasticity splint. Hindi naman nakasabi dito ball CVA splint, di ba? This is ball anti-spasticity. So any patient with presentation of upper motor neuron lesion like spasticity, you can apply this kind of splint. Next, we have the trigger finger splint. Para saan? It's for trigger finger. The name speaks for itself. Pangalan pa lang, nagsasalita na. Ako daw yung splint for trigger finger. Okay. How does it help you in trigger finger? It maintains your extension. Bakit ba? In trigger finger, you have the presence of here. We have the nodule. Nasa kamay mo, may nodule ka. Most commonly, it occurs in the first, it occurs in the MCP or the first A pulley. Yung A1 pulley, okay, the A1 pulley is found in your MCP. Okay, you have the presence of a nodule in your tendon that allows it to become restricted in the gliding within the pulley systems. So pag nag-flex yung MCP, okay, pag nag-flex yung MCP, automatically magkakaroon ng locking of the joint into flexion. So nahihirapan yung mga patients with trigger finger to extend their finger. So what do? We maintain the extension po and the splint looks like this. It maintains your extension. So if the trigger finger is A1 pulley or MCP affected, you apply your trigger finger splint like this. But if the trigger finger applies or occurs in your other pulley systems such as in the ito pala DIP or PIP, you apply the oval 8 splint. Na remember pa yung oval 8 splint? You apply that one, you recommend that one, you prescribe oval 8 splint if the affected trigger finger is PIP or DIP. Pero pag MCP yung affected, ito metacarpophalangeal, you prescribe your trigger finger splint. What does it do again? It maintains extension. Please take note of the picture kasi yung quiz nyo mamaya, it's about the picture. Okay, let's proceed. Let's have the next one, ulnar deviation splint. Ulnar deviation splint. Okay, if you are listening, may ulnar drift, can you tell me what condition sa musculoskeletal rehab nyo has common deformity of ulnar drifting? Can you comment anong condition yung may ulnar drifting sa MSK rehab nyo? Anong condition yung may ulnar drift of the fingers? That's
RA, sir.
okay, correct. RA, that's rheumatoid arthritis. So ito, common siya in RA. So you apply the ulnar deviation splint for our rheumatoid arthritis patients because it reduces the ulnar drift. So you won't be confused anymore because ulnar deviation splint, it reduces the ulnar drifting. Ito yung mukha niya. It appears like this. Okay, it appears like this. So pag ulnar deviation, yung fingers mo, it moves towards the ulnar side. So itong ulnar deviation splint, it pulls your fingers towards radial deviation. Again, your ulnar deviation splint, it pulls your fingers towards the radial side, towards radial deviation. So meaning towards the thumb, Because the deformity is towards the ulnar side, yung splint, it pulls your fingers towards the thumb side or the radial side. Now let's have the elbow neoprene sleeves. The elbow neoprene sleeves. Okay, if you look at the picture, ayun siya. The neoprene there, ito yung neoprene. It's the material used in the cloth. It's the same as the cloth na masks these days with the print and the colors. Tapos nilalagyan siya ng surgical mask inside it. Okay, that's the one. Neoprene material. Okay, it is used for mild elbow sprains. So for example, mild lateral epicondylitis, mild golfer's elbow, or mild lang na valgus stress mo yung elbow to provide a little bit of stability. Ito po yung piniprescribe natin. Elbow neoprene sleeves. Again, for mild elbow sprains. Because it is tight, no, medyo tight siya hang on to the skin in our elbow and forearm area. So it provides a little bit of stability. It provides stability. Or rather support kasi ano siya, it's a flexible. Hindi siya rigid, flexible device siya. So its purpose pala is to provide support. Konting stability, guys, kasi it's also tight when it is attached to our skin. Next, we have our forearm band or counterforce brace. Forearm band or counterforce brace. Okay, forearm band or counterforce brace. Please look at the picture. Ito po yung may TID, yung brand, yung puti siya, applied in our forearm. Guys, kaya basi magawa sa quiz. Okay, I will let you determine the name of the orthosis or the splint. Tapos, ibibigay nyo, you will choose in the choices ano yung pangalan ng splint basing on the picture. Okay, so this forearm band or counterforce brace is used for, ito na siya, tennis elbow. Tennis elbow. How does it help your tennis elbow? It adjusts the force of the pull of the wrist extensors. Okay, kumbaga, when you do your wrist extension, yung nagre-receive ng impact is our forearm band or counterforce brace. Kaya nga counterforce, because instead of the muscles receiving all the impact, si brace or si forearm band yung nagre-receive ng impact, kaya counter force siya. When it is applied here in the elbow, medyo tight siya. It hangs on to the forearm area very tightly. So, ang nagre-receive ng force is the forearm band instead of our wrist extensor origin. Instead of the lateral epicondyle area, yung nagre-receive ng force, it is our forearm band. Again, this is for tennis elbow, forearm band. Yung mukha niya parang black, yellow, tapos may BIP brand. Or TID or DIT, I don't know how to read that. Again, it receives the force instead of the wrist extensor origin, which is our lateral epicondyle. Next, we have the long arm posterior splint. Long arm posterior splint. Tingnan nyo yung picture. Long kasi siya, mahaba. It extends from the arm going to the forearm. It extends from the shaft of the humerus going to the whole radius and ulna. Kaya long arm. Okay, and the reason why it is called posterior kasi it is found behind your elbow. Tingnan nyo yung picture, oh. It supports the posterior portion of our elbow. Don't look at the volar surface of the forearm. You look at the portion of the arm and the elbow. Nasa posterior siya, nasa triceps area siya, nasa olecranon process siya. Kaya posterior splint siya in terms of the arm area. That's why it is called the long arm posterior splint. Okay, it is used for injuries. Anong injuries? Injuries in the elbow and proximal forearm. For example, fracture or dislocation dito, elbow and proximal forearm area. Okay, you want to stabilize from the arm going to the wrist and forearm. So you use the long arm posterior splint. Injuries of the elbow, kasi nandito naman talaga siya, and the proximal forearm. So yung mga fractures at dislocations. Long arm posterior splint, once again, is used for injuries of the elbow and proximal forearm. Tinawag siyang posterior splint because it is found in the posterior area of our arm and elbow. Okay, next we have the single or double sugar tongue. Single or double sugar tongue. So ito, sugar tongue siya. Okay, tongs kasi parang yung tongs may dalawang area. So one is found anteriorly, one is found posteriorly. Pag isa lang, for example, only the horizontal area, then that's single tongue. Pag forearm and arm, then that's double sugar tongue. Again, pag isa lang, horizontal lang, then that's single sugar tongue. But if it is both horizontal and vertical, forearm and arm, radius and ulna and the humerus, then that's double sugar tongue. Okay, it is used for distal forearm injuries. Distal forearm injuries. It limits the motion of the forearm and wrist. It limits the motion of the forearm and wrist. So forearm and wrist talaga yung nalilimit niya. But it will allow, okay, again ha, it will allow forearm pronation, supination. So can you still supinate and pronate? Can the patient turn the arm here? Yes, the patient can still supinate and pronate. It does not limit the forearm movement, but it will limit, okay, it will limit your wrist movement as well. Okay, next. We have the volar forearm splint. The volar forearm splint. All right, the volar forearm splint or the cock-up splint. The other name is the cock-up splint. It is also used for ito, carpal tunnel because it holds your wrist into extension. The cock-up splint or the volar forearm splint, ito po yung common name niya, cock-up. Cock-up kasi it ups your wrist into extension. Ito, naka-extension siya. That's why it is called cock-up. Kasi naka-up yung hand. Okay, yung hand po naka-cock up. Okay, it positions your wrist into slight extension, kaya it is used for carpal tunnel syndrome as well. If you can remember, we have our carpal tunnel splint. Okay, yung carpal tunnel splint, ang sinabi ko that it wraps around your thumb in some way. Ito siya, cock-up splint. So if you seen the picture sa quiz, may black and white. Tapos tingnan nyo, black and white siya. Okay. It does not have a thumb attachment or parang spica around the thumb. So it is your cock-up splint. Kasi yung carpal tunnel, if you can remember, the carpal tunnel splint, parang yellow siya, no, in the picture. Just to help you in your quiz, ha? So again, the cock-up splint, otherwise known as the volar forearm. Volar forearm kasi nasa volar portion siya ng forearm mo. Volar forearm splint, it holds the wrist into slight extension and it is used for carpal tunnel syndrome as well. Okay, next we have the burn splints. The burn splints. The burn splints are, guys, we're almost done. Okay, again, guys, we're almost done. The burn splints are our splints used for burn patients to prevent their contracture. Again, are splints used for burn patients to prevent contracture. Bakit? If you have burn, you are at risk, you are at high risk to having contractures. Okay, where are these contractures? Let's go to our body, human body here. Iisa-isahin natin yung different areas. Let's start with the neck. Okay, dito sa neck area, in your neck area, your burn patients will have high likelihood of obtaining neck flexion contracture. Again, for your burn patients, yung common po dito is neck flexion contracture. Neck flexion contracture. So what will you apply for your splinting sa burn patients? You will apply a splint that will promote extension or hyperextension. Extension or hyperextension. So again, if you will have a burn patient, tapos may burn siya sa neck area, whether anterior or posterior, please promote the extension of the head or hyperextension of the neck. Okay, again, for burn patients, the most common contracture is flexion contracture. Flexion contracture. So pag flexion contracture in the neck, when you apply your splint, ina-apply po siya to promote extension or hyperextension. So the name of your burn splint is just hyperextension brace. Hyperextension brace. So far, do you get the idea? Okay, magigets niyo yan kasi sa burn splints, opposite lang the contracture motion. Opposite lang the risk, opposite to the risk of having contracture. The direction of the contracture rather. Okay, let's proceed to the shoulder area. Shoulder area. Dito po sa shoulder mo, okay, in your shoulder area, the common contracture is adduction and internal rotation. Adduction and internal rotation. May slight flexion din po, just like your stroke. The shoulder, pag burn yung patient, yung direction, yung position of having contracture is adduction, internal rotation, and slight flexion. Emphasis po sa adduction and internal rotation. So in the shoulder, what we apply is our airplane splint. Airplane splint. Bakit po airplane? Kasi parang pakpak. Ayun o, parang pakpak siya. Okay. The position of our airplane splint will promote abduction. Naka-abduct siya, 90 degrees. Tingnan nyo. External rotation. If Sullivan po yung pagbabasehan natin, she will also say, dapat may flexion. So flexion, abduction, and external rotation, yung tatlong motion that we want to promote using the airplane splint. Okay, again, what are the motions that are being promoted by your airplane splint para ma-prevent natin yung burn, contracture sa shoulder, flexion, abduction, and external rotation. Emphasis po sa abduction and external rotation. Pag nasa practice kayo, pag may burn patients kayo, mapapedya man or adult, please promote abduction and external rotation of the shoulder. Kasi pag inadduct nyo yan, the patient will have a lifetime disability. Do you want your patient to have lifetime disability? Mambalang patient, hindi na ko ka-overhead because wala ko yung tudloan ni PT nga dapat gali abduction and external rotation. Okay? No, no, no. Please, guys, if may burn patients kayo, especially pedia patients, please promote sa shoulder abduction and external rotation. Guys, masakit ha. It is very painful and maluoy kagid kung bata, 6 years old and below. But guys, it is needed that your shoulder should be in abduction and external rotation for our burn patients. Okay, I hope that is clear. Susunod tayo in the elbow and forearm. In your elbow and forearm, the common burn contracture is elbow flexion and pronation. Elbow flexion and pronation. Parang stroke talaga. Again, the common deformity due to burn contracture in our elbow and forearm is elbow flexion and forearm pronation. So if you will apply splint, what should be the splint? Okay, the splint should be posterior elbow splint. Posterior elbow splint. Bakit? We want to promote supination and elbow extension. Correct. We want to promote supination and elbow extension. Pag sa hand, we want to promote intrinsic plus at ayaw po natin ng intrinsic minus. Again, in the hand, we want to promote intrinsic plus and not intrinsic minus. So ano yung pwedeng i-apply sa wrist and hand? Remember your resting hand splint? Your resting hand splint, pwede yun. What about the ball anti-spasticity splint? Okay, pwede rin. But the ball has the rough surface or irritating surface. So much better yung resting hand splint. Again, in the wrist and hand, gamitin nyo po yung resting hand splint to promote intrinsic plus position because the common deformity sa wrist and hand is intrinsic minus or claw hand deformity. Okay, just a recap. Pag sa neck po, promote natin extension, hyperextension. In the shoulder, we want to promote abduction and ER. Okay, some sources would say flexion. Pag sa elbow and forearm, that's extension and supination. In the hand, intrinsic plus po. Intrinsic plus. Syempre, wrist extension din, guys. Okay, next, we have in the trunk. In your trunk, kindly promote extension or neutral extension because the common deformity is trunk flexion. The common deformity is trunk flexion. So you will apply burn splint that will promote neutral extension of the trunk. Emphasis po sa neutral extension kasi ayaw naman natin na mag-hyperextend yung trunk. No? Kakalaw ay man ang tao galakat ng hyperextended, di ba? Okay, so you promote in the trunk neutral extension. Ito po, straight alignment. Okay, let's go to the hip. In your hip, okay, in your hip, the common deformity is flexion and adduction. Flexion and adduction, either IR or ER. Again, in your hip, sa hip joint po, yung common deformity due to burn contracture is flexion, adduction, and either ER or IR. So yung hip is prone to having either of the rotation na deformity. Pwedeng IR deformity, pwedeng ER deformity. So again, yung common deformity is flexion, adduction, and either rotation deformity. Pwede siyang fadir, pwede siyang father. Okay, so what will you promote? You will promote neutral rotation, pero ayaw din natin ng full IR. So please, in your hip burn patients, when you use splint, you promote neutral rotation of the hip and maintain it in neutral extension as well. Again, for the hip, you maintain neutral extension and neutral rotation. Ay, may isa pa, neutral abduction as well. Neutral abduction. We don't want abducted siya. We don't want adducted din siya. I think some sources would say slight abduction, but clinically, hindi ko rin mare-recommend yung abduction kasi that will lead to wide base of support kay patient. Okay? So, pagdating sa hip, in a clinical practice, lahat po ng movements of the hip should be in neutral motion. Okay? Again, for your burn splint, you promote neutral motion of the hip, neutral position of the hip. Next, sa knee joint. In your knee joint, the common deformity is flexion. The common deformity is flexion, so you provide the patient with posterior knee splint to allow or promote extension. In your knee joint, the common deformity is flexion. The common deformity is knee bending. So you will apply the burn splint, posterior knee. Posterior knee kasi gusto ko naka-promote yung extension. If the knee is extended, then you can bend it. You can just flex it. But if the knee is in flexion, ay abaw, hindi mo na ma-extend. Lastly, last na lang guys, in your ankle, you promote dorsiflexion or neutral dorsiflexion. Neutral dorsiflexion. Yung subtalar motion is also in neutral subtalar motion. The common deformity in your ankle, leg, and foot is inversion and plantar flexion. parang ankle sprain, inversion, and plantar flexion. So what do you want to promote? Okay, you want to promote eversion or dorsiflexion. Better yet, naka-neutral position. Okay, again, in your ankle and foot, you promote dorsiflexion and eversion. Dorsiflexion and eversion, or better yet, neutral position of the ankle and subtalar joint. Okay, let's have our recap. Recap po dito sa trunk natin should be in neutral alignment. The common deformity is trunk flexion. In your hip, what do we want to promote? Neutral position po in all planes because the common deformity is flexion adduction and either IR or ER. In the knee, the common deformity is flexion, kaya we want to promote in the burn splint extension using the posterior knee splint. Highlight po natin posterior knee splint. In the ankle, leg, and foot, the common deformity is plantar flexion and inversion. We want to promote dorsiflexion and eversion. Better yet, neutral ankle and subtalar position. Alright, that's for our burn splint. Last guys, elderly splinting. Pagdating sa elderly splinting, you have your geriatric patient, for example, please do consider sensation problems. So pag si patient may sensation, in our elderly or geriatric population, possible talaga na may sensation problems. Do you agree? Yes, I believe you agree, no? So to overcome our sensation problems, you consider having frequent inspection of the skin. I-inspect mo yung skin. Baka mamaya ikaw yung cause of having breakdown, skin breakdown, o di kaya yung different complications. Remember your complications? Merong dermatitis, merong ischemia. What if ikaw yung cause nun kasi hindi ka nag-inspect ng skin doon sa my splint area? So please, pag geriatric, ilagay sa chart ng patient, frequent inspection of the skin where the orthosis or splint is applied. Tama? Yes. Last consideration, kindly consider circulation impairments kasi nga si patient may fragile skin. Okay? Circulation impairments. We consider here as ischemia kasi pwedeng too much pressure from the splint may cause ischemia. And at the same time, the pressure from the splinting can cause heat. Pwedeng mag-friction or heat is being built up in the area where the splint is applied. Kasi covered yung area, so basi init, uncomfortable. You may use your stockinets to dissipate the heat. Your stockinets or pwede ring towel, or anything that can cover the skin before the splint is applied pag elderly. Diba si init, diba bis kang kita gani kung nag-bandage for a very long time, basi mareklamo ta, na do ka init, do ka uncomfortable. So you apply your stockinets for our elderly patients. Okay? Guys, any questions so far? Okay, I believe none. All right, guys.